Okay, I think Esther has brought us through very quickly to the, through the whole VCP, and I think that provides a very good foundation for me to actually really share, to see whether how you can actually start doing your own VCP if you have not started. So a very warm hello to you. I know that this is like lunchtime. I will do my best, okay, to make it as engaging as possible, and really, let me just introduce myself. I'm James, all right? So I'm a social worker by training. So I started in social work, and well, I stumbled upon, and this is really true, I stumbled upon volunteer management. All right, to be very frank, it wasn't something that I thought I would do, but I stumbled upon it, and I really love doing it, So I've been doing it for the last almost 20 years already. And I've been with different organizations. I've started being a volunteer coordinator in Salvation Army, and then moved on to Care Corner, and then now in Shine Children and Youth Services. I'm also the manager for volunteer partnerships and development in Shine now on a part-time basis. Why I mentioned part-time is because, after my last stint, I actually started a social enterprise that actually looks into also fueling good. Okay, that means to grow good. So through mental resilience work and also volunteer management training. So these two volunteer SVP, strategic volunteer partnerships, and mental resilience are really what I'm really, very passionate about, and what I really have been always getting myself busy. In fact, sometimes over busy, and I don't hope to really burn out while doing this. And I like to call myself a ripple effect change maker because a lot of the things that I do, whether it's mental resilience or even volunteer partnerships, right, it's really to grow impact. All right. So those of you who are actually interested to connect with me over LinkedIn, that's my LinkedIn profile if you are interested. All right. So what am I doing here today? Really, I won't really say that, I've been there, done that. All right. We are actually still on this journey. So it's really work in progress. I saw this sign. I took this photo. I can't remember when, but I was just looking through my gallery and said, hey, this is interesting, work in progress. Our VCP definitely is still work in progress. And really what I hope to do today is to share our journey with you and hopefully to resource yours. All right. If you already currently completed your VCP, congratulations. If there's anything that you can actually take away from what I'm going to share, that's great. I also frankly love to learn from you also. If you have done your VCP, we can exchange pointers. If you have not, then I hope that what I'll share will provide you with really some maybe like checkpoints for you, pit stops where you can actually start to see, okay, so maybe this is where I should work towards next and all that. All right, so this is an overview of what I'm going to share today. 5 main things, okay? First, I'll share very quickly the context because I think it's important for you to know about the context of care. That means what does Shine do and how we actually partner volunteers. Then we actually talk about the genesis. That means how does this whole thing start, okay? The strategy, where we are currently, and then of course, lessons we've learned, okay? So without further ado, let's start first with the usual about my organization, but I promise you this is only a 1-2 slide thing. Okay, so Shine basically we started in 1976. Some of you may know us by our own name. We weren't called Shine in the past. We were called Student Care Service. Frankly, I didn't know that until I joined Shine. We are a registered charity, NCSS member, and also IPC. We are not really I wouldn't say we're really a large charity. We're medium size with about 90 on the team, comprising social workers, social associates, educational psychologists, and learning support specialists, and various functional specialists as well, right? Like people looking into finance, fundraising, all that. And really what we want to do is we want to enable children and youth to maximize their potential. So every year, because if you think about it with a staff team of 90, right? We serve more than 8,000 service users and families, and that's really a lot. And we are able to do that because of our partnership with volunteers. So we serve our service users are mainly between 5 and 21. All right. So and these are where we are located. The various locations. We just like any other social service agencies out there, we do preventive, developmental, and remedial work. Based on research theories and also practice wisdom, guided by core values, and of course, very importantly, a very strong part of Shine's work is in strategic partnerships, where we really partner with the community, the volunteer program and all that. What you'll see above me, basically, these are the 4 service pillars of Shine, where the work kind of like cluster around 4 main areas of in the school, in the community. Educational psychology service is more working with children children with learning difficulties. And lastly, targeted intervention service is more looking into very specific areas where children and youth may need program and interventions, like, for example, in youth mental health advocacy and all that. Okay, enough about Shine. Now, I want to actually start with a little bit about the genesis. That means, how did the whole thing of how did we actually start working on this? To be very frank, okay, definitely one of the things why we need to work on it is because we are also currently on the enhanced volunteer manager funding scheme. So as part of the deliverable, we need to actually look into it. But I'm glad that that was actually part of the deliverable, because if not, we wouldn't have done this. And really, why we kind of gave an internal name. So our internal name is, the document is called Partnership Continuity Strategy, because that's the whole spirit behind it. We actually want to see whether how do we actually continue very important partnerships in the event of a crisis. So one of the spirit behind it, right, is really look into service continuity, because we want to say that when something hit, right, we can continue to provide the service to our service users. We can continue to help them to maintain, or even, if even possible, enhance their psychosocial well-being. And of course, for children and youth also, we want to see them being able to continue to develop healthily during this crisis. All right, even though we are not able to be, for example, in COVID-19, we're not able to do service delivery face to face. The other thing why we actually want to do the VCP is also because of staff and volunteer well-being, right? Because if you think about it, the pandemic has actually caused staff really having to deal with a lot of uncertainties, right? How do you actually provide service to people? And they have to think about that, and it's very difficult. There are a lot of uncertainty to work with. And it's during this time, right, that I think that, is the need for volunteers are even higher, because I think we can really share the load, right? All hands on deck, everybody help a little bit. And so the thing is, that's also the reason why we want to do the partnership continuity strategy. And of course, one other thing is the guideline for crisis, because whenever anybody is in crisis mode, right, you don't have time to think, right? You don't have the bandwidth to go and think what to do next. So you need to actually have a set of guidelines, like signposts, to tell you what to do next. Lastly, on-off volunteer engagement. Now, because of I'm blocking the T. Okay, so because of the nature of the work that we do, right, and we partner with a lot of volunteers, we realize that we cannot go with a very binary kind of volunteer engagement. That means, oh, crisis comes, switch off. Okay, crisis over, switch on off. It cannot be like this. So, we need to actually have a way of thinking, how do we actually work with volunteers in the event of a crisis? All right, so we need to kind of take a phased approach. So I kind of took this opportunity as I'm preparing this presentation, right, to kind of look back, okay? As much as I will tell you, say, wow, when I sat down, I have a whole map, I know what to do already. I actually didn't know what to do, So now I'm looking backwards, okay? So when we first started, right, one of the things we did was, of course, we looked at what was already available, and NCSS had the VCP guide, which was really very, very helpful. Yeah, initially, when I was looking at the guide, I was like, oh no, this looks quite complex. But then, of course, I attended one of the engagement sessions where they talk about the VCP guide, and I think that's helpful. Pretty much what Esther was sharing earlier on, and it helps to give a little bit of assurance, all right. And of course, the other thing also, we wanted to look at existing VCP guidelines as well in Shine, because no point go and reinvent the wheel, right? I mean, sometimes there could be business continuity plans, and you want to develop something that is very aligned to your VCP also, not something starkly different, okay, and incompatible. And of course, we also look at existing risk management guidelines as well. So in Shine, there are existing risk management guidelines, okay, but that's a little bit different. Okay, so we kind of look at all that, we research, and in fact, for research also, I also went to do research in terms of like when Google and those kind of things. So that's the kind of the first thing we did. The second thing we do is we identify. So we basically look, okay, who are the people that we can actually design this VCP together with? Now, to be very frank, nobody had any idea how to do this. All right. So because I'm a VMP, right, volunteer management practitioner, right? So I made a very bold move. You know, I went to try to see whether I can find a volunteer to help me with this. Okay, so I actually went out and I actually got a volunteer. All right, and I actually proposed this. And then he used to be, I understand he used to be a management consultant, used to be a McKinsey. You know, and actually I worked with him on many projects, including process mapping for our volunteer management system, and also now this VCP, VCP. And a lot, we're working on a lot of other strategy things. Of course, the other thing also is we need to identify the objective, the spirit behind the guide, why we want to do. We have to be very clear, okay? Because we don't want this to be an academic exercise or table, you know, it's just like a paper exercise that we do. We wanted to really understand why are we doing this. We want to understand from the staff point of view. And we want to understand what are the different crisis scenarios also, okay, that this guide will cover. Okay, then we look into the design of the actual document, the actual guide. And we are looking at, one of the things we try to see is how to actually design in a very easy to follow framework. And what we do is we kind of cluster everything into a few common crisis scenarios. And we actually put up a volunteer role matrix. I'll share a little bit more of this later on. Okay, so this is the unique feature of the PCS. All right. And after doing that, right, after designing it, then we actually look into developing it. Okay, so where we actually develop, so in this case, we look into like the template. So we look further. Okay, it's not just about a document with the guidelines, but we also look into like the templates, the decision-making matrix, you know, and then what do we do? So the steps. So it needs to be operational. Okay, as much as it is strategic, it needs to be operational also. And it needs to have tools to help people, okay, to move in the event of a crisis. And after that, right, then we basically obtain endorsement from management and from staff. Okay, incidentally, we are actually going to meet with so as part of our as part of our kind of like change management, right? I will be meeting with some of the volunteer management volunteer partnership practitioners next week. Okay, to also take them through this whole document in detail. And this is actually where we currently at. Okay, we are at a stage of implementing. Okay, where we need to train people, we need to tweak forms, we need to tweak processes, and we need to make sure that the guide is easily accessible. Okay, so that's really our journey. Now the strategy. Let me take you through the guide. Okay, so the guide as fast as possible. Firstly, the strategy is the type of crisis, because we don't want to have a situation whereby we have one guide for every different crisis. We want to identify what are the common guidelines, okay, that will apply to as many crises as possible. So we identify 3 buckets. One is disease outbreak and pandemic, like what we are in now, okay, COVID-19, you know, those kind of things. The others is man-made events like war, you know, terrorism, riots. Okay, so I kind of have to play the devil advocate there. I got to think of what can go wrong. And the last one is natural disasters and events like floods and haze. Okay, so once we identify all these different crises, right, what we do is that we put together a framework called so I call it the PIN model. Okay, the PIN model stands for prepare, implement, and new normalization. So if you look at it, it actually mirrors to what NCCS has as well. All right, the 3 phases. So it's really about the before, during, and after. Okay, and this is what we do. So prepare, implement, and new normalization. Now, let's look at the prepare. So in prepare, right, what we have to do, what we wanted to do first is that we wanted actually to put volunteer roles into a matrix. And this 2 matrix, what we do is we try to actually put it on one spectrum is the support, the kind of support that they're providing, whether it's a primary support and secondary support. Now, we're very careful of this term. Okay, we don't want to put, unfortunately, don't want to put important, not important, or you know, essential, non-essential. Okay, but we just put primary and secondary. Okay, I think it's much more palatable. And then secondly is whether it's service user facing or non-service user facing. All right, so what we do down here is we actually split our volunteer roles into this matrix. We classify them. All right, and this will actually allow us to actually do phase suspension of volunteer engagement in the event of a crisis. All right, so this is the first under prepare. Okay, now what other things do we do under prepare? Under prepare also, we need to form a PCS team, and we need to identify who are the main stakeholders. So the main stakeholders are all those that you mentioned down here. So in Shine, we have an ecosystem of people working with volunteers, okay, including of course the VPD manager, which is me, the executive director and the senior management team. All right, the volunteer leaders, the volunteer partnership architects and volunteer partnership practitioners. Now, you may, just very quickly, you may ask me, so what is this? I'm the only full-time person working on volunteer partnerships and development here in Shine. So I need help, right? So basically architects, if you think about architects, they're the people who design, right? So these are actually the people who actually do strategic planning with me. They actually are, they could be social workers, you know, who also double up and actually come and sit together with me and design more on a strategic level. The volunteer partnership practitioner is actually more on the operational level, so they actually run the program. So each of them has a specific role in the team. All right, so this under the prepare stage. Now, what about implement? Okay, so in the event that a crisis really happened, right, we have also come up with a decision matrix. That means to say that, right, at which alert level, what are we supposed to do? So like you can see down there, right? Oh, okay, at, for example, alert level 2, okay, the onset of the crisis. And the crisis that we're talking about down here is not the one-off crisis. It's any kind of crisis that will threaten on an ongoing basis the delivery of service. All right. And you can see down there, we actually put very clearly, okay, PCS 1, 2, 3, 4. That means which kind of volunteer role can continue and which kind cannot continue, and what are all the various mitigation action we need to take. So we actually have a whole, you know, decision matrix of that, a few pages of that, that actually highlights the main points. All right. So I hope that's actually helpful for you. And then, of course, other tools we have would include things like, you know, like when we actually want to plan statements. Okay. All right. How do we communicate? And, you know, so all these down here, we actually will put down, okay, like the mode of communication, the source, the audience, the key message, the effect, and the response. Okay. So some of these are actually developed, you know, because I also run a social enterprise. So I actually, what I do is I actually do bring over some of these resources over into the PCS as well. And this is actually the stage where we are currently. We're still under implementation now. This toolkit down here that you see down here is actually the communications toolkit. So we also have a communications toolkit where literally you can say that this is like a cheat sheet lah. Okay, how do you actually craft during the event of a crisis? How do you craft statements lah? All right. So down here I tell you, say, oh, this is the update number what, you know, and then on which date, you know, explain the situation, you know, we acknowledge, So they actually give you some. It's like a template lah. Okay, for messages that needs to go out during crisis. And then at the last stage, right? So after prepare, after implement, and now it's a new normalization, we also provide the kind of the steps that needs to take place, you know, in the new normalization. So that will include things like reviewing the VCP to make sure that it's up to date, you know, even making sure doing a retraining, having a timeline for full recovery, do communication, things like that. Okay. Continue to include this in the handbook. We are actually working this into our training as well. And when I say training, it's not just for the VCP training. We're actually including this into our volunteer management training as well for all staff, because for all staff that come on board into Shine, they have to go on board this thing called practice onboarding training. This is literally like 1 week. Actually, it's quite a number of different modules, and volunteer management is actually partnership is one of it. All right. So we are here now. What does that mean? Okay. I mean, we haven't really completed the whole cycle, but what does it mean for us? Just when I was about to actually do the next step, right? The safe management measure actually eased, which is good news. All right. Which means to say that now we can start doing all our VTLs really, okay, volunteer transformation lane. Okay, we can restart individual volunteering, corporate volunteering, skills-based volunteering, you know, even co-design volunteer roles with volunteers as well. But that being said, right, you know, we also needed to find out, okay, there are still a lot of things. So for me, I have to do my due diligence as well. So I went to, of course, MSF website and look at all the safe management measures and all that. And what I did was that, right, I actually went to put all this into a flow chart, you know, so that it's easy also for practitioners to really at one look know, okay, so what happened if a person is tested positive, you know, all those kind of things, and then if they come, or so so that's really what we did it into a flow chart, you know, so it's to make it easier. So rather than a 20-page SOP, we actually put it into a 1-page. Hopefully we capture the main points. Other things that we did for new normalization include like, because we are going the route of doing the classification of volunteer roles, right, from the very start, we had to include this into our volunteer role design form as well. So in the volunteer role design form, when our staff request for volunteers, they have to indicate the nature of interaction and the nature of service. And they indicate, and then based on that, we assign a PCS level. So that when crisis hit, right, we kind of know, okay, so which are the roles to suspend and which are the roles that can continue. We had to also change our volunteer application form, okay, to also include, like statements about being vaccinated and all that as well. So as I round up, right, all this, okay, I also want to learn, there are lessons definitely that we learned. So what are some of these lessons? These are the challenges, okay? The challenges is that definitely this is something new. I myself haven't done anything like this before. Not, in fact, I don't think anybody in Shine has done this before. Another thing is that we need to align to existing policies because there are really a lot of policies internally as well. It cannot be everybody going their own direction, and then it's very haphazard. People get very confused. Another challenge is we need to implement and need to get buy-in from people, right? Because one of the major change management is that people think, it's just another policy, it means more work for us. So how do we actually get people to really buy in? And lastly is change is the only constant advisories, right? I mean, it's like, we all know, right? Just as we ready, then, safe management measure change again, okay? So then that's what I mean to say that every time change, you got to change your VCP and all that, right? So these are some of the challenges that we have to be very mindful. So what did we learn? We learned that this is actually an all hands on deck exercise. It means to say that everybody needs to be on deck on this, including volunteers. What can volunteers actually do to actually help you, right? If you have certain volunteers who are in your database who are very good with this kind of things, processes, who may be management consultants or used to be management consultants, get them to help you, okay? Sit down together, get your team together to look into it, and really looking into the spirit of it. I think the main thing about it, I just want to share very candidly. When I came up with this one of the things that my executive director came to me and says that, James, what if safe management measures change again? Then does it mean to say you have to change the whole flowchart again? So because of that, right, what we did was that we actually took out we actually identified what are the main, the main, how should I say, the main guidelines that won't change, okay? Because the principle is to ensure that the safe distancing, all those kind of things. But the details, like for example, like how many people can congregate, all this, right? We actually put it in a separate bubble, lah. Okay, so it's here, lah. So the main guidelines won't change, one, it will be here, and then all those that will change will be here, okay? Like how many people can go back, the staff strength and all that. The other thing, of course, is needs and buy-in. We need to actually also, for us, we feel that because we need to get buy-in from the staff, we need to really understand and, in a way, get their buy-in by speaking their language. So for Shine staff, what's the buy-in? The buy-in is basically, they are very passionate about their service users. So the buy-in is really, I will play up the part about, this allows us to actually provide service, to continue providing needed service and supporting our service users, right? Another lesson learned is not to reinvent the wheel, definitely. So look at the NCSS, VCP, look at, all the other things, including your existing policies and all that. And then, of course, being mindful of how it will affect your processes, okay? Because definitely it will affect your forms, it will affect everything. So even how you actually work with volunteers, okay? The last two things I want to highlight is positive languaging, okay? So we need to be very mindful about certain languaging as well. If you remember, I actually opted for primary support and secondary support, okay? It's quite important because in a crisis, people tend to be sensitive, so we also have to be very mindful of that. And lastly, the perfect plan. Will there ever be the perfect plan? I don't think so. And I think if we actually were to think about it that way, right, we won't be so stressed of crafting the perfect plan, because frankly, I don't see the one that we have now as the perfect plan. But I at least I see it as a good foundation where we can definitely. So even next week, when I actually dialogue with my staff, as in all the other volunteer partnership practitioners, right, I'm actually open to actually tweaking it, because if there are other inputs from the ground, right, then we will see like, how can we actually fine tune it. Okay, so I think there will always be some blind spots that we wouldn't have seen, so we can tweak it, and with that kind of mentality, I think we won't be as stressed about it. All right, so that's my sharing. I hope it really has been helpful, learning from our journey, the mistakes that we made, and all of that. And if you want to connect, right, this is my contact details, all right, and my email and my handphone number. Yeah, I mean, that's really all I have.